Now, we'll quickly talk about the differences between type 1 and type 2 diabetes mellitus because this is kind of like a confusing stuff. So I won't lie, even me too, when I started reading about diabetes mellitus, that's in my fourth year of medical school, I actually had some problems trying to understand this type 1 and type 2 diabetes mellitus. Okay. So I'm glad that now I can be able to copy it up and still put it out for anyone who is having problems with understanding it. So I have notes on it. We have notes on it. Okay. But I think the most thing is okay, on the notes I spoke about diabetes mellitus type 1 differently. I spoke about type 2 differently. Then we now compared the two of them. Okay, but the thing is you can just use this I can just use this picture to explain from this place so that you can understand. For diabetes type 1, type 1 diabetes, there's no insulin production from the beta cells. There's beta cell destruction. While for the diabetes type 2, there's insulin production, but the cells are resisting it. Now, this insulin is not even produced adequately. You get? All right, so let's talk about it now. For the type 1, we said that there's an autoimmune destruction of pancreatic beta cells, which will result in absolute insulin deficiency. What are the characteristics? It typically develops in childhood and adolescence. There's rapid onset of symptoms since there's no insulin at all. Insulin therapy is required right from diagnosis. Okay, right from diagnosis, you start insulin replacement therapy already. Then there's increased risks of diabetes ketoacidosis. Right? What are the symptoms? There will be polyuria, there's polydipsia, that's you'll be feeling thirsty. Polyuria, you'll be urinating so much. So as you're urinating so much, you want to replace the fluids. There's weight loss, there's fatigue, there's blood vision. What is the diagnostic criteria? If you do a fasting plasma glucose and it's more than 126 milligrams per DL, if you do oral glucose tolerance test and it's more than what? 200 milligrams per DL. If you do a glycated hemoglobin and it's more than 6.5%, then if there's presence of what? Autoimmune antibodies. Then for the type 2, it's a metabolic disorder which is characterized by what? Insulin resistance or impaired insulin secretion. You get? Two things are involved. So it's either that the insulin is not being produced enough or it's being produced but the cells are even resisting it. Typically develops in adulthood. It's gradual onset of symptoms since the insulin is acting relatively. You get? Then it's often associated with obesity, physical inactivity, family history. It may be managed with lifestyle modification or oral medications initially. So type 2 is kind of like less severe. You get it now. Symptoms, there's polyuria, polydipsia, fatigue, blood vision, slow healing of cuts or bruises. Okay. Fasting plasma glucose will be more than what? 126 milligrams per DL. Oral glucose tolerance test should be more than 200 milligrams per DL. Then glycated hemoglobin will be more than what? 65%. All right, so you get it now. So that's it for the differences between what? Type 1 and type 2 diabetes mellitus.